Avi Weisfogel, Happiest Dentist. Coming to you today with a story that I hope you find interesting, and I hope it stirs something inside you. So I get calls every single day from dentists, some of whom are like, hey, is this sleep thing for real? Hey, how can I get involved with this? What's involved with this? But the call I got today was more interesting, and it was more along the lines of, hey, I getting tired of dentistry, and I started placing implants, and I'm honestly almost there, but then I started thinking, man, when am I going to get out of this? How am I going to get out of this? This is just more and more dentistry. What would you do if you were me? Would you keep going with this implant thing, or would you do something along the lines of dental sleep? Now, this is something, if anything, I'm qualified to give advice on. It's this. Would I give up regular dentistry in exchange for sleep apnea? With the answer obviously being a resounding yes. Not only would I, this is exactly what I did. Giving up regular dentistry to go after the sleep dream. Now, for most, sleep apnea and making it in sleep apnea just is not a reality. There are so many rules and regulations in place, and they make it so hard for you to succeed that most people take a course, try it, quit, and they're done. Now, honestly, and I'm not saying this in any kind of negative way, most of it is because the teaching that's being done is not going through all of the rules and regulations that you need to know and understand in order to win this battle. This is a game, the sleep apnea game, where the guy who knows the most wins. If you're the one who knows the rules, it's very easy to put something in place that allows you to adhere to all the rules and make it easy, right? So what are the rules involved here? A, dentists cannot diagnose sleep apnea. Whether you can or cannot order home sleep tests, you shouldn't order home sleep tests because you may not get paid from the insurance company if you do. And in the end, imagine going through all this work and having the insurance company say, you didn't follow our guidelines, so we're not paying you. Or worse, we paid you, you didn't follow our guidelines, now give us our money back. All of this are the things that can happen in sleep apnea, which is why if you're going to learn this field, you have got to learn the business end of it. You've got to know all the rules, you've got to know all the laws, and then you've got to make sure that you are totally within those so you can not only get paid, but keep the money as well. Now that's one piece of the pie, right? The other part is getting patients. How do you get patients? Is it the common way where it's go get referrals? Yeah, that's the way to get 2 patients a month. Or is it the different way where you become the one who is in control of the entire flow of sleep patients in your area? When you become the guy who is in control of the entire flow of sleep patients in your area, you become the guy holding all the cards. All the patients get sent through you, one way or another. Whether it's they don't know what to do with the sleep patients, they send them to the guy who they hear knows what to do with sleep patients. Or it's you've kind of created this patient, so you're going to guide them through the way that makes the most sense. Now, keep in mind, you're only going to do what's best for the patient in every single case. If you have a program that's just designed to feed yourself and feed your pockets, it doesn't really work. It's got to have some validity to it. The validity being, hey, let's make sure these patients are taken care of so that way it all ends up looking on the up and up. Now, I can tell you, doing all of this, knowing all the rules, playing the game, would I give up dentistry for sleep apnea? 10 times out of 10. Because all you got to do is learn the rules, apply the system, and then you can't fail. It becomes that simple. So if you're in that position where you're thinking, hey, I'd like to give up dentistry, I'm not sure if I can, maybe this is the way for you. I know it certainly is the way for me, and I know it's certainly the way for many people that I work with. Sleep apnea is just a wonderful, fulfilling field. I say it's the most underutilized, most profitable, stress-free, gratifying procedure you could possibly do. So should you give up on it? Maybe. That's up to you. But should you learn how to do sleep apnea the right way? Absolutely. check us out, dentalsleepmba.com, and find out how you can learn all the rules and become the guy who's in charge.